Every year, over 600,000 people die as a result of cardiovascular disease. Do you have heart disease, or do you know anyone with heart disease? Do you know if you're at risk for heart disease? Do you have diabetes, hypertension? Do you smoke? Are you overweight? Or do you sit a lot? If you answer yes to any of these, it means that you probably are at risk for heart disease. So in our show today, we will be discussing cardiovascular disease. We will look at the symptoms, we'll look at the risk factors, we will look at the diagnosis and the treatment. And most importantly, we will discuss how you can prevent yourself from dying from this disease. Tell me a little bit, what is coronary artery disease really?
Coronary artery disease is called ischemic heart disease. Like probably we know, the body has the heart as a pump. The main function of the heart is to pump the blood from the heart to the body, but the pump per se, the heart per se, has their own circulation. When these arteries to the heart get obstructed, is called coronary artery disease. This is almost normal because we rarely doing a normal patient, but some patients even having what we call abnormal stress test, the coronary arteries are not that bad.
Right.
No? For example, this is the right coronary artery. There is a little lesion here if you go in detail comparing to the normal side. In the heart, there are main three arteries. No? Okay. Two coming from the left main, the bifurcation in the left circumflex, and the left anterior descending artery in the front of the heart. And the one that we saw initially was the right coronary artery. Basically, this has minimal obstruction, only mild irregularities. For this patient, is good news. Only we need to continue controlling cholesterol, diabetes, hypertension, antiplatelet therapy, but we don't have to do any intervention.
Chef Edgar, welcome.
Hey everybody, how y'all doing? Welcome to the kitchen. Another exciting portion that we have for you all.
Are we cooking today?
Today we are going to talk about different foods and different substitutes that you could do to your diet.
Healthy swap.
Yeah.
You're probably wondering, why does she have meat and fish in her studio? Why do we have meat and fish?
We do not cook it, but
we're going to show you the difference. We're going to show you why it might be better to go plant-based. Do you have diabetes and want to get rid of it, or high blood pressure and want to improve your blood pressure? Then we have something special for you. Active living 30 minutes a day or 60 minutes a day will cure your diseases.
The exercise with resistant bands, going to focus on the lower body. We have our beautiful ladies here just to show us. We're really going to focus on the front squat right here. We're going to use a little bit more abdominal muscle. To sustain us here, we're going to have the girls bring the resistant bands all the way up, drop all the way down. Let's go. We're going to get a good 5 in.
Today you've learned that cardiovascular disease is the #1 killer. But there is hope. If you are diabetic, if you have high blood pressure, if you walk and you have chest pain, if you're overweight, then probably you're at risk for heart disease. But there is hope. Remember that the #1 killer for any disease really is the food you eat.